Welcome to another episode of Public Health Musings, the podcast that delves into the world of public health to inspire us to take meaningful action. I'm your host, Dr. Caroline Kingori. We're constantly on a mission to bring you thought-provoking discussions and inspiring stories from the world of public health. To start us off today, we have a remarkable guest who's here to share insights from her new book and inspire us to make positive impact in health equity and inclusion. But before we get to that, this episode is brought to you by Okera Coffee. Elevate your coffee experience today with premium freshly roasted beans delivered to your door. So use code SAVE10, SAVE10 for your first order, or SAVE16, SAVE16 for any 3 products at checkout. Treat yourself at shopokeracoffee.com. That's SHOPUKIIRACOFFEE.com. So I'm excited. Our guest today is Dr. Renee Branch Canady, CEO of Michigan Public Health Institute, MPHI. And she's a dedicated advocate, researcher, and leader in the field of public health. Dr. Canady's new book, Room at the Table, A Leader's Guide to Advancing Health Equity and Inclusion, offers a compelling perspective on these critical issues. So as we explore the stories and wisdom she's gathered throughout her career, we hope that this conversation will empower you, our listeners, to become catalysts for change in your communities and profession. So join me in welcoming Dr. Canady to the show, everyone. Yay! So glad to have you. So glad to have you. I'm so excited you're here talking to us about this book. And so usually I like to know your motivation and how you got to where you are. And then, can tell us more about the motivation behind the book. So can you share some insights or experiences from your journey as an equity public health leader that motivated you to write Room at the Table? And then what was that turning point that made you want to share these insights with a broader audience?
Mm-hmm. Well, I love that question. And I also love origin stories. And so I'll just share sort of a snippet of mine. I actually started out my career expecting to be a physician. The secret in my closet is I spent 2 years in medical school figuring out that I don't want to be a physician. And my mother was a public health nurse, and she would always come home with these amazing stories and these shocking stories and what that really happened and her frustrations in trying to serve the public in public health. And so as I was applying to med school, I did a gap year and did a bachelor's in public health nutrition. And that's where I was like, man, I probably should have done public health. But hey, I'm going to med school now. But it is that 1 year that really shaped I'll say my leadership philosophy around the privilege of serving and partnering in community and with community. So left medical school and landed in the mid 80s in a new position called the AIDS educator position, when it was like, yeah, go talk to them about AIDS and teach them things. We don't know the things. What? But I realized in that time it was about honoring the fear, the angst, the uncertainty, the lack of trust, and being open to that. And such a privilege to hear people when they were worried and scared and saying, you know more than we know, even if you don't know that much, helping them feel heard. And that's kind of been the trajectory that has continued. I sometimes say that I looked for my first job and my rest of my jobs looked for me, which is not to sound arrogant, but is to sound open and ready. Like, just do your job and be content in what you're doing at that time. Bring excellence and power to it. And it opens up. I tell my mentees, your talents make the space for you. They make room for you at the table, if I can play off the title. Those opportunities, many of them you could never find yourself. Others are bringing them to you. And so it's been just an amazing 30 plus year career, all in public health. I can't believe it. Don't try to do the math. I'm not going to tell you. So yes, I landed doing local governmental public health, ended up in then some state projects with our state health department and our Department of Corrections, still doing AIDS. Did some teen pregnancy stuff in between. Ended up in the university and decided to finish my doctoral studies. Like, let me put a period on that, and ended up doing medical sociology, which was actually why I was going to medical school, not to be a clinician, but to impact how people, how the systems interact with people when they're ill. Figured I would just stay there as a tenured faculty. It was a great role. I loved it, and then got recruited back to the health department where I started my career to come be in leadership, and served as deputy health officer and then health officer. And, the journey continued when I was elected to the board of Michigan Public Health Institute, MPHI. And sure enough, here I am. So I do have enough sense to not say I'm going to retire as the CEO of MPHI, because then the next opportunity comes a calling. So I'm just going to stay focused and content. And it's been a very, very powerful platform for me.
That's really awesome. It's exciting to know this journey. I love listening to people's stories, and it also helps motivate me, motivate my guests. So the second part of that question, what was that turning point, that made you want to share your insights with all of us in a book?
I am a relationship-driven leader. My mentor, who is like my virtual mentor, he doesn't really know me. We met at a conference, but his work has inspired me. Dr. Ron David, he says relationships are primary. All else is derivative. And I've always been driven for relationships. I battle racism, gender oppression, class oppression, because they damage relationship. And so began just because I love relationship, I love communication. I actually, as an undergrad, took an extemporaneous speaking course as an elective. And it's the main course I remember from my undergrad studies. But sort of with this gift of gab, just began talking to people about what's hard for you, what's helpful for you. And my students and my mentees, I'm a mentor for a fellowship program. They all would say, "Oh, Dr. Canady, you have to write a book. You say these little things." And then we get back, we're like, "What did she say? We should have wrote it down. You need to write all these things down for us." And then one day, readiness and timing met opportunity. When opportunity came to me, and I was approached by a publisher who said, "We are seeking out inspirational leaders that have a subject matter expertise. And we've noticed your online presence." And I was like, I don't have an online presence. What are you talking about? But when we met, they were like, "Yeah, you don't do a lot of social media, but you have a lot of speeches and keynotes and things that are out there on the internet that we've noticed." And that started the journey. I had a very, very supportive board of directors at MPHI, or I have a very supportive, and they were like, "Yes, write the book. We'll support you." And it's been, again, we keep using this term journey. It's been a fabulous book writing journey, just learning how to document and validate our own lived experiences. And that's what I tried to do in my book.
That's fantastic. I like the use of that word because we are constantly on a continuum, So let's get a little bit into your book. You do emphasize the importance of acknowledging and understanding differences rather than dismissing them. So could you provide some practical strategies or examples from your own life, your work, and some of the things you've put in that book on how individuals and organizations can foster a culture of inclusivity and equity?
Mm-hmm. Ooh, big, heavy question.
Right.
Let me just first start with that word diversity.
Right.
And, if you think about the word diversity, it simply means differences. And although we say, "Oh, let's value diversity," when we're faced with difference, we get very uncomfortable. I mean, I would ask my students, and I ask your listeners to think about a time when they were in a situation where they were very much aware of their difference. And usually I ask my students, don't describe the situation to me. Tell me the feelings. How did it feel to be different? I've asked that question hundreds of times, literally, and I can count on one hand the feelings that were affirming. Most of them were, I felt frustrated, I felt angry, I felt embarrassed, I felt out of place, I felt set up. Nobody says I felt affirmed and special and valued and unique. Nobody says that. And I tried to unpack that as a sociologist. It's like there is something that draws us together, a tie that binds us. We want to be with people and we want to be like people. And so, how can we, in a very authentic way, affirm that difference is not a barrier, but that difference is a strength, and that we have to unlearn some things where we've been socialized all the way from, you know, adolescents or teenagers. Ooh, you're wearing those jeans. Nobody wears those jeans anymore. And ooh, and then as an adult, oh, you're driving that car. Nobody's. It just follows us. And so, without an intentionality to say, no, I value difference in an authentic way. In a, you know, so when people say things like, oh, I don't see color, well, you're missing who I am. I want to see the totality of who you are. And so just seeing where difference has been a barrier for populations pursuing health or advocating for needs for their community has been a real problem. And so it's just been a challenge for me to get people to be comfortable with difference. And the only way you do that is to lean in to that discomfort. And before you know it, it's like, oh, yeah, no, I used to be, I sometimes give this silly example of way before tattoos were as popular as they are now. I had these assumptions about people that got tattoos. And when I would see this long sleeve, which I didn't have that term then, of tattoos, I'd immediately be nervous. I don't know who that person is. They're not like me. And now I see peers who are more accomplished than I that have beautiful tattoos. I'm like, I get it now. It's just a choice. But it was only with leaning into that discomfort that I began to learn. And so those are the very initial steps, because it's really less about diversity and being able to check a box. Yes, we have 5 of these and 10 of those. It's about a culture of inclusion and a culture of equity, and equity being fairness and justice, and not, oh, in our country, we sometimes say, oh, we have to treat everyone the same. Oh, it's not fair. You know, everybody's got to have this. And well, you know, I say that sometimes the most unfair thing we can do is to treat people the same. People have different needs. I have 3 sons that are now adults. If I had treated them exactly the same, it would have been chaos in my home, because they were each motivated by different things. They had different talents and abilities. They had different interests. And you have to understand, folks, that's for clinicians, teachers, preachers, community partners. How do you allow people to be who they are and meet them at the point of their need, not just saying this is what it is and it's this way or the highway. I was asked a couple of weeks ago to do an interview about DEI and public health. And I decided that DEI and public health does not mean diversity, equity, and inclusion. It means disrupting every inequity. Our DEI is about assuring the conditions that people need to be healthy. And now there are systems that get in the way of that. So how are we going to disrupt every inequity that keeps us from being the best public health professionals and keeps our communities from being their healthiest self? So that's my little flip on trying to get public health. Don't worry about diversity and the metrics and the numbers and how many and the percentages. Don't worry about inclusion. Inclusion comes out of relationship. If you're authentic about letting people be themselves and honoring who they are. And then fairness is the foundation of that. And we do a lot of talking about valuing equity. We're not going to be able to value equity until we emphasize and disrupt the burden of inequity. I tell my students, yes, everyone's saying social determinants of health. I want you to think about social determinants of health inequity. That's in the way right now.
Wow. Like literally we can end this here. Like and even just try and, talk about that farther. But it leaves a lot of more questions, which is great because we're trying to understand. You use the word lean in, you use the word equity. And I'm wondering in your book, as we talk about how to disrupt, I like that word a lot, inequity, there's always this concept of privilege. That's what often brings about that inequity, right? And so in your book, you discuss the concept of privilege and its impact on our thinking and action. So how can we, especially those of us in leadership, recognize and leverage that privilege to advance this health equity without perpetuating inequality?
Yeah, I think first of all, to not self-blame, I have privilege, and I feel so bad. The interesting thing about Peggy McIntosh's work on privilege, which she did around gender, she talked about male privilege. Well, men don't get to decide if they're going to be born a man or they're going to be born, they don't get to choose their gender. None of us choose our gender. And many men at that time were just benefiting from a system that put men at the hierarchy, at the top, a higher point in the hierarchy of value. They didn't necessarily do anything to design that either, certainly not this generation where we're now talking about privilege. And we all have privileged identities, and I would submit identities that are more oppressed. As a Black woman, I don't have racial privilege, but I do have educational privilege. I have religious privilege as a Christian in this country. And so beginning to understand this is not about bashing white men who we think have all the privilege. It's about helping white men and all of us from our stance of privilege understand, what am I doing as a Christian that is harmful to my brothers and sisters who don't practice that same faith? What am I doing as a doctrinally prepared person? How am I disrupting hierarchies of credential within the organization I lead? We had a real debate once that, do you have to have a Ph.D. to be a center director at Michigan State? And why is that? Because you very well know there are some doctrinally prepared people who have only book sense and no applied intellectual relevant knowledge. And there are those that have a master's degree or maybe don't even have a college degree, who are brilliant and insightful and analytical. And so we began having those conversations. I very much try to walk the talk. I don't want to just give lectures. I don't want to just write a book. I want to agitate people to think differently. And so that's where I've been trying to push us in public health to go deeper. Not just, oh, yes, we said diversity. Oh, yes, we said equity. And we did a food festival and everybody brought in a food from their upbringing. Yeah, that's okay. And we played the different music. And I remember years ago doing AIDS work, and I saw this video, and the consultant in the video said, as an educator, I submit to you, if our only learning activities are focused on food and music, then the only outcomes we will get are overweight people who dance. Right. So what are the learning objectives that were out there? Let's see. Yes, it's very nice to bring in your cultural food, but what are you talking about as you sit there together and break bread? How is that food a vehicle for deepening relationship across difference?
You're really dropping these gems. Okay. I'm like, I need 5 minutes to just take this in. There's so much in there. And I can't wait for this to be published so that I can listen to this over and learn. But I like your take on privilege. And sometimes we do forget those nuances, which is why, as we talk about community-based participatory research, right? Recognizing that when we talk about engaging the community, knowing how are we, entering into the community? Are we coming in as Dr. So-and-so? And they don't care about that. They care about these needs that are important to them, priorities. CDC says this, but what is the community saying? What is their understanding? And I like that, what you've said, because it helps us pause and take time for introspective work within ourselves, right?
And if I can just piggyback on that, it reminds me that responsibility is for all professionals, regardless of our race, class, or gender. I'm reminded of being when I was on faculty full time and doing research in community with Black women about pregnancy outcomes. Now, myself as a Black woman who had the experience of delivering my son, my first son, at 28 weeks, having the experience of burying him in 6 months when he died due to complications of his prematurity. I figured those lived experiences and those identities validated me. But I had been educated in a system that did not validate those things. So when I went back into community to give them the results, I'm being accountable, community-based participatory research, here's our findings. And one woman threw up her hand and she said, "You're just as bad as those older white men who do research on us. You're just out here telling us what we're doing wrong. What are we, give us a break." And it just floored me. And I said, I'm doing to you what I've been taught to do in a system that wasn't structured to affirm people that don't have those privileged identities. And so it was a life-altering moment. And we started that dialogue all over again. And it shaped how I interpreted the qualitative data that I had gleaned in relationship and conversation with those women.
Right. And I find it really interesting often because we in our headspace so much and in our privileged cocoons, and you go into the community and they tell you, no, you're not all that. Okay. And it makes you take a pause and you're like, okay, let's revisit this. How do I make this relevant to you? So yes. In your book, you talk about it as an invitation to embark on a journey towards equity justice. So give us some key steps or principles that, my listeners or readers can expect to learn from the book to help them be better advocates for health equity in our communities.
I think I'm always trying to come up with the next best soundbite. I'm not a journalist or a communications person, but for my own learning style, things stick with me better when they're sort of nuggets, when there's something either alliterative or, contradictory, yin and yang kind of a thing. And lately, as I've been thinking about my book in a sort of summative way, and again, pushing leaders to be courageous, to use their platform, to not be silent, I've been saying to them, first of all, this is not about you. But guess what? It's all about you. So at this very deep level, when you're worrying about your reputation and your personality, and I don't want to say the wrong thing, and I don't want to be called a racist, it's not about you. Get beyond yourself to look at the needs of these communities with whom we have relationship, right? Public health is nothing if it's not about the public. And the public is the people. But once you get that revelation, on the other hand, it is all about you. It's about your attitudes. It's about the way you're engaging people. It's about your own values. What is the tone, particularly as a leader, that you're setting? Is it dismissive? Is it inviting? Is it engaging? Or is it my way or the highway? This is what we're doing today. And that requires some, I'll just say, courage from leaders, because my job would be much easier if I just say to my 1,000+ employees, this is what we're doing. This is what y'all have to do. Here are the priorities. Just go do more of that. But I've set up a culture where I encourage them to lead up, to manage up, we're learning together pushback skills. When someone that you're in relationship with that has more power, how do you push against that? And boy, they are practicing what I preach. And so they challenge me and they question me, and I go, yeah. And in that, they make me better. And so I I love this quote that I do have in the book by Howard Koh, who's a professor at Harvard, a former assistant secretary of Health and Human Services. And he says, there's something about public health leaders that cause them to leave the comfort of the sideline and wade into controversy. I love that, because it's a choice you have to make. It's like, am I going to wallflower this one and just be here and hoping that no one notices me? Or am I going to take a deep breath and just, here we go. Here we go. And so I think that was absolutely one of the things that motivated me in writing this book, because it was like, you're in these meetings and people don't want to say the thing, or else they're always waiting, like, Renee, say something. I'm like, I'm going to be strategically silent, because you're not going to hide behind me. You're going to get comfortable with your own truth. It's not so much about what we know as professionals. What's more important is, what do we think about what we know? What do we believe about what we know? That's what drives our actions. And that's what leadership is. It causes us to shape opinions and being willing to, plow the road so that those that are coming behind us that have not yet garnered the privilege and the power can comfortably pass through. And so that's kind of the whole so what for me behind the book. I hope that people will read this book, find their courage, and be willing to step up. We act a little bit like the civil rights movement checked all the boxes for us in the United States. It started the journey. It didn't conclude the journey. And I think my generation certainly just was like, oh yeah, we're good. Good enough is good enough. No, no, no. And now we have this next generation of public health colleagues, new and early career folks, saying, why aren't we doing this? They're challenging us, and our job is to make space and get out of their way. And so how do we do this work across difference, across generation, across gender, across academic and preparation, to pursue this shared goal of our mission in public health, which from C.E. Winslow, all of those founding theorists would say, our mission is to assure the conditions necessary for good health. And we can't do that without addressing racism and classism and gender oppression and all those other things.
Indeed. And I like that quote about jumping into controversy. I mean, if there was something that was controversial, COVID-19, right? And your book talks about making room at the table. So what are those lessons that we need to learn? Jumping into this COVID-19 controversy where we were literally walking in the darkness, made a lot of mistakes, didn't make room at the table for our communities. How do you see your book guiding us when another controversy comes up, when another, COVID-19 kind of situation, epidemic comes up. What do we do?
Yeah. The title of the book came from my publishers, reviewing content and saying, hey, we want to pitch a book title to you. I already thought I had a book title. I was very excited about my book title. The book title I had is now sort of the post of the book. We called it the Akobin, the Call to Arms. That was the title I thought we were going to have. And you'll have to read the book to find out what that was. But they said, you have this theme that keeps coming up about making room for people at the table. And I did that because when I first started doing this work very deeply, shaping how do we prepare the public health workforce? How do we do this in community with community? I did this work with a colleague whose identities were indeed polar opposite from me. He was a man, I was a woman. He was white, I was Black. He was agnostic or atheist, and I was deeply invested in my faith as a Christian. I had the Ph.D. He had the bachelor's degree. We just were completely polar opposite. That strengthened our personal and professional relationship, and it drove what we would do. But my colleague would say to me, stop trying to protect white people. Why are you always trying to protect the white people? White people can do, and I'm like, I'm not trying to protect white people, but I'm trying to keep them at the table, because people that feel threatened or uncomfortable and have privilege leave the table. I feel like you're calling me a racist. I don't have to do this. No, you don't. So how am I going to set a table that you're comfortable staying at? And at the same time, for BIPOC individuals, people of color, I don't want it to be a painful seat at the table either. Here I am telling this story one more time. I've told the story of my son Howard and his death a couple of times. So it was easy for me to get through that with you today. But there are days when I'm like, man, big knot in my throat, can't do this today. But how am I going to set a table, make room at a table where they're like, no, we're not gonna force you to tell your stories if it's painful for you today. But we need everybody and all of their journeys to keep us driving forward to make change. It's not going to happen. If Black people had the power to fix racism, we would have done it, because it's killing our children. It's going to take Black and white together, as the lyrics of a song go, and all of us, regardless of what our racial identity is. So yes, I do want a table where there's room. I'm thinking about, when my grandmother and my mother were alive and we were having a big dinner. It wasn't like, oh, sorry, no more room for you. It was like, pull up a chair. Here, scooch over. We were making room for everybody, and it sometimes required atypical things. Here, take the placemat and put it on your lap, but you're still pull up your chair and still be near us, still be in community together, so that relationship again can drive us to advance change.
That is just fantastic. Often I think we tend, in our introspective space, in our introspective selves, fear comes in, and it really determines how we act. And I think when we say, scoot over, come here, that can make a big difference in making room at the table for ourselves, our colleagues, but mostly the communities that we work with. So you've been involved in various leadership roles. Can you discuss some of the initiatives or recommendations that have emerged from your work with all that you've done, and how they relate to those themes in your book about equity and inclusion?
Absolutely. Let me first offer that I do not see leadership as positional. It is not about the position, I say. It is about the positioning. And sometimes If I think back on my AIDS educator, brand new job, like literally no work experience. I think my only job at that point was like a cash register at a cafeteria on base. My dad was military. I never worked. I didn't work through college. That's privilege, right? And so my literal first job was as this AIDS educator, a completely new job. But I quickly learned that I had a lot of leadership in that role because people were looking to me to educate them, inform them, help them. My health officer, Renee, look into XYZ about this. That was me, him offering me leadership to shape and influence. That's leadership. And so, yes, I've had a number of positions now toward the end of my career. I guess at some point I get to retire, where I was the positional head in the org chart. But I know a lot of people that sit in positional head seats that are not leaders. So I just want to agitate you all a little bit on how you think about leadership. But yes, from day one, I remember as a, here I am, this, I don't know, I must have been mid-20s when I got that job. And there was a small rural community, predominantly white community, where they had a young boy who had contracted HIV through a blood transfusion. And remember then we were all talking about innocent victims and guilty victims, I guess. I don't know what that terrible narrative was. But my health officer said, okay, here's the situation. Probably should do a community meeting. And so I'm like, I set everything up. I'm like, oh, we can use the community library and this and that. I checked the health officer's availability. And then I came back to report to him. He's like, I'm like, all set. It's on this date. It works with your calendar. We can ride out together. And he's like, well, I'm not going. I'm like, excuse me? It's like, why would I go? I'm not the AIDS educator. And all I could think was, how are you going to send me with my very young face? I knew that I looked like the high schooler in the room. You're going to send me out to this community of predominantly white, panicked people. No, they need you. He was a white man. And he was like, nope, you're the leader on this one. And that, again, was a pivotal interaction. And yes, sure enough, I went out there. They just wanted to hear the facts. They just wanted to know, my kid sat next to this kid at school. Is he going to now get sick? And who's going to die and who's not going to die? And it was one of the most affirming experiences because it taught me what public health was. It's not just about me coming out with facts. I did more listening in that session and affirming than I did teaching. But I sometimes look back and I say, boy, if I was the health officer, would I have trusted this brand new employee to go do that? And I'm embarrassed to say that I don't think I would have. And so what are those opportunities for us to bring influence and change, regardless of our position? When I was the director of student affairs at the College of Nursing at Michigan State, the leadership opportunity to say, well, you guys are saying that we want a diverse student body, but the metrics that we use almost systemically disadvantage a certain sector. Because if you didn't take calculus in high school, you're going to struggle with college math. And if all we're doing is looking at GPAs and rank ordering them and counting down 80 or 75 or whatever the number is and sending out letters, you're going to have a very, an admission group that really lacks diversity. And what is the qualitative metric that we're looking at? Who are these students? Even if they are white students, do they understand the value of diversity and difference? And have they had lived experiences that will make them a stronger, better nurse? Have they studied abroad? Did they go to a predominantly Black church as a white person? Or what were those lived experiences? Not just the quantitative, count that down. That was a leadership opportunity, because in that setting, here I was with an administrative appointment in a college of nursing as someone who was not a nurse. And so figuring out, how do I deal with the othering? How do I do this in a way that doesn't persuade? I mean, equity leadership is not about convincing people. I always say you don't have to have all the answers. You have to have the questions. And then you trust the process of people thinking through, no, I never thought about that. And so then we had this powerfully diverse class. I had set a goal for myself at 25%. When we hit 25%, I can retire. It's like, I said that same thing at MPHI. We're now at 29% and counting. So not, again, that it's about checking a box. It's about, what does that represent for us and how we do our administrative processes, and then in the culture that we're building at our organization. So everywhere I've been, I've just had this value. Maybe it was growing up in a military family and traveling all over the place. And let me tell you, folk in Kansas are very different from folk in Arizona. And folk in Arizona are very different from folk in North Carolina. And so learning those things and having the opportunity to live abroad. We lived in the Philippines, and my parents made the choice for us to live in community, not on the base, because they said on base, it's going to be just like being in the United States. And so those epiphany causing moments, I'm always asking people, no, don't tell me what you do. Tell me who you are. Who you are as a leader shapes the philosophy of practice in how you engage others.
Amazing. We are coming to an end. No, this has been so fantastic. So many gems, so many lessons and learning points. And I just wanted to give the listeners and the people watching, for you to tell them, how can they have access to your book? Where can they find your book? Because this is something that I think every household needs. I'm waiting for mine to be delivered soon. So great book. How do people have access to it? I know I'd find it, but
I appreciate that. You actually can order this book through any bookseller. They can order it for you. My publishers admit that Amazon is the largest bookseller worldwide. So it is available on Amazon. I do know, though, some people like to support local bookstores. I did my initial book signing at a woman-owned, Black-owned bookstore here in Lansing, Michigan. But I would ask, if you're going to purchase through Amazon, consider doing a review. Look at that. I only have 8 reviews. I need more. So they tell me, that's what they tell me. Oh, you have to ask people to do reviews. So correct. I'm an easy study, so I'm doing that now. But I'm so grateful that people seem to respond really well to the content in the book. I want it to be a help. I'm not there to compel, persuade, convince. I'm here to say, here's my journey, and your journey story is as legitimate as mine. And it will take all of us to really make this country the nation that we say we are, that it values everyone and is a nation of opportunity for all. That's my goal before I retire.
Amen to that goal. Is there anything else you would like to tell us, that a question I didn't ask? I liked how you said it's not about having the answers, it's constantly having those questions. And that's what helps us learn more. I think it helps us fight that fear that often we have when it comes to talking about differences. And there's nothing wrong with differences. It's finding that happy medium when we can.
Absolutely. I can be very intellectual and say, I want you to focus on the cognitive and the affective and the behavioral. But the simple way that I say it in my book is, let's just see things differently. Let's say things differently, and let's do things differently. In emergency preparedness in our field, we talk about do one thing. It's the same thing in equity work. People are like, I don't know what to do. Do one thing. It's like getting into a pool. It doesn't matter whether you go down the slide, whether you cannonball into it, where you go up the high dive board, just get in the pool. However you're most comfortable getting in the pool. And then you'll begin to realize, this was not as bad as I thought it was. Man, jumping off that high dive wasn't as scary as I thought it was. And I know that change will happen. Change is beginning to happen. And so our responsibility is to leave things better than we found them. That's what public health is and does.
Yes, our responsibility is to leave things better than we found them. So that brings us to the end of another captivating episode. This was so fantastic, Dr. Canady, of Public Health Musings. And I'm hoping that this discussion has left you feeling inspired and equipped with valuable insights to advance health equity and inclusion in your life, in your work, and among your community, your friends and loved ones. But I want you to remember the journey to a healthy and more equitable world starts with each one of us. And I think that's what Dr. Canady's book is telling us today. Whether you work in public health or any other field, we all have a role to play in creating positive change. So if you enjoyed today's episode and want to stay connected with us, be sure to subscribe to Public Health Musings on your favorite podcast and leave a review there as well. And as always, we encourage you to share this episode with friends and loved ones. And thank you so much for joining us today. And until next time, remember that every musing about public health can lead to a meaningful action. So let's keep the conversation going. Thank you again, Dr. Canady. So glad you came on today. And we'll follow up with you for your second book, right?
Indeed.
Yes, we are calling that to fruition. So thank you, everyone. Until next time.